What if your doctor could predict serious health problems the moment you walked through the door, before you even opened your mouth to describe a single symptom? This is not science fiction. Physicians are trained to observe specific hygiene habits that reveal hidden illness, and today you will learn exactly which 5 habits raise immediate red flags. By the time you finish watching this video, you will understand what your daily routines are telling medical professionals about your heart, your brain, your circulation, and your overall lifespan. You will also discover precisely how to correct these warning signs before they develop into dangerous conditions. Pay close attention to habit number 3 because it affects nearly 70% of seniors. Yet most people have absolutely no idea their body has been desperately signaling for help. When 67-year-old Vincent arrived at his doctor's office for a routine annual checkup, he felt completely healthy and expected nothing unusual. But within seconds of shaking his hand and observing his general appearance, his physician immediately ordered comprehensive blood work. 2 weeks later, Vincent received a diagnosis of early-stage diabetes, a condition his everyday habits had been revealing for months without his awareness. Habit 1. Abandoning regular oral care. Your mouth serves as a direct window into your entire body's health, and when you begin skipping brushing or flossing, doctors recognize far more serious problems than simple cavities or bad breath. Most people assume oral hygiene matters only for dental health, but medical science has proven this assumption dangerously wrong. The bacteria living in your mouth do not stay confined to your gums and teeth. They enter your bloodstream through inflamed gum tissue and travel throughout your entire body, settling in places that can cause catastrophic damage over time. What seems like a minor habit of neglecting your toothbrush actually creates systemic inflammation that affects your most vital organs. Research from Harvard Medical School has confirmed that poor oral hygiene is directly linked to significantly increased risk of heart disease, stroke, and cognitive decline in older adults. The connection is so well established that cardiologists now routinely ask patients about their dental care habits during heart evaluations. The American Heart Association has reported that active gum disease can raise your risk of heart attack by nearly 50%. This happens because oral bacteria trigger inflammatory responses in arterial walls, contributing to plaque buildup and eventual blockages. Your morning and evening brushing routine is quite literally protecting your heart with every stroke of the brush. The consequences of ignoring oral care extend far beyond an unpleasant smile or occasional tooth pain. Bacteria from infected gums enter your bloodstream multiple times daily, especially when you eat or brush inadequately. These microorganisms silently attack your heart valves, damage your arterial walls, and even cross the blood-brain barrier where they contribute to neurological deterioration. You feel absolutely nothing while this internal assault continues day after day. By the time symptoms appear, significant damage has already accumulated inside your body. Lorraine, a 72-year-old retired teacher, always assumed that bleeding gums were simply a normal part of getting older. When her dentist finally referred her to a cardiologist, imaging revealed substantial arterial inflammation requiring immediate intervention. The solution requires no complicated equipment or expensive products. Brush your teeth twice daily for 2 complete minutes each session, reaching every surface of every tooth, including the gum line. Floss every single evening before bed, without exception, removing the debris and bacteria your toothbrush cannot reach. If your gums bleed when you brush or floss, schedule a dental appointment immediately because bleeding indicates active infection. Replace your toothbrush every 3 months and consider an electric toothbrush if manual dexterity has become challenging. Every single day without proper oral care adds more dangerous bacteria to your bloodstream, so make tonight the night you commit to protecting your heart through your mouth. Habit 2. Neglecting foot inspection and care. When was the last time you actually examined the bottom of your feet, really looked at them carefully under good lighting? Most seniors cannot remember because feet remain hidden inside shoes and socks, easy to ignore until something goes seriously wrong. Yet physicians specifically examine feet during senior wellness visits because these extremities reveal critical information about circulation, nerve function, and metabolic health. Your feet are located farthest from your heart, making them the first place where blood flow problems become visible. Changes in your feet often appear months or even years before symptoms develop elsewhere in your body, giving you precious early warning time if you simply pay attention. The Mayo Clinic emphasizes that foot changes frequently serve as the first visible sign of diabetes, peripheral artery disease, and nerve damage in older adults. Johns Hopkins physicians receive specific training to evaluate feet because circulation problems manifest there long before patients notice anything unusual. Diabetes in particular damages small blood vessels and nerves in the feet first, causing subtle changes in skin color, temperature, and sensation. Peripheral artery disease restricts blood flow to the lower extremities, creating visible signs like pale or bluish skin, slow healing wounds, and hair loss on the toes and lower legs. These conditions are extremely common in seniors, yet remain undiagnosed for years because people simply do not look at their feet regularly. Ignoring foot health creates a dangerous cascade of worsening problems. Small cuts you cannot feel become infected wounds that refuse to heal. Minor discoloration progresses to tissue death, requiring medical intervention. Numbness from nerve damage prevents you from noticing injuries until serious damage has occurred. In the most severe cases, untreated foot problems lead to infections, ulcers, and even amputation. Every single one of these outcomes is preventable with simple daily attention that costs nothing and takes less than 1 minute. Samuel, a 69-year-old retired electrician, ignored a small dark spot on his toe for several weeks, assuming it was merely a bruise. That minor discoloration turned out to be a circulation issue that required vascular intervention to prevent permanent damage. Make foot inspection part of your daily routine starting today. Every morning when you put on your socks, take 30 seconds to examine both feet under adequate lighting. Look for any color changes, including redness, paleness, or bluish tones. Check for cuts, blisters, or breaks in the skin that you might not have felt. Notice any swelling, unusual warmth, or cold spots that could indicate circulation problems. Keep your feet clean and completely dry, especially between your toes, where fungal infections begin. Apply moisturizer to prevent cracking, but avoid the spaces between toes. Your feet are showing you problems that your body cannot communicate any other way, so look at them carefully today and every day forward. Habit 3. Showering or bathing. Less frequently. Here is something doctors notice immediately but rarely discuss directly with patients. When seniors begin bathing less often, it almost always signals something much deeper than simple preference or convenience. A sudden decline in bathing frequency ranks among the strongest early indicators of depression, cognitive decline, or undiagnosed mobility problems in older adults. This change often happens gradually, making it difficult for the person themselves to recognize. What begins as skipping one shower becomes a pattern of avoidance that reveals underlying struggles requiring attention. Physicians understand that bathing involves complex physical and cognitive demands, making it one of the first activities to decline when health problems emerge. Researchers at Stanford University Medical Center have documented that changes in bathing habits frequently precede formal diagnosis of serious conditions by 2 to 3 years. The Centers for Disease Control and Prevention notes that alterations in self-care routines serve as important screening indicators for cognitive impairment in older populations. Bathing requires balance, coordination, memory of sequential steps, and adequate energy levels. When any of these capacities begins declining, bathing often becomes the first casualty. Depression similarly reduces motivation for self-care, making the effort of showering feel overwhelming even when physical ability remains intact. The connection between bathing frequency and underlying health status is so reliable that many geriatric assessments specifically include questions about hygiene routines. Beyond the physical and cognitive connections, avoiding bathing often represents an attempt to avoid confronting uncomfortable realities about declining abilities or emotional struggles. Seniors may feel embarrassed about needing assistance or afraid of falling in wet conditions. They may lack energy due to undiagnosed thyroid problems or anemia. Depression, following loss of a spouse, friends, or independence, commonly manifests as neglected self-care long before other symptoms become apparent. The longer these underlying issues remain unaddressed, the more dramatically they worsen. After her husband passed away unexpectedly, 74-year-old Denise gradually reduced her bathing from daily showers to once weekly. Her daughter recognized this change as a warning sign and helped her mother access grief counseling that transformed her recovery process. If you have noticed yourself bathing less frequently, approach this observation with curiosity rather than shame. Maintain a consistent bathing schedule, even if you need to make modifications for safety and comfort. Install grab bars near your shower or tub if you have not already. Consider using a shower chair or bench that allows you to bathe while seated securely. Switch to a handheld shower head that gives you control over water direction without requiring difficult movements. If bathing genuinely feels overwhelming, speak honestly with your doctor about why this change has occurred. A change in bathing habits represents your body asking for help in the clearest way it knows how. So answer that call immediately rather than hoping the feeling passes on its own. Habit 4. Ignoring changes in your nails. Did you know that your fingernails and toenails constantly tell stories about the health of your heart, lungs, liver, and thyroid? Most people view nails as purely cosmetic features, painting them or trimming them without ever examining what they actually look like underneath. Yet nails grow slowly and record changes in your internal health over periods of weeks and months. The color, shape, texture, and attachment of your nails provide valuable diagnostic information that physicians are specifically trained to interpret. Dismissing nail changes as unimportant cosmetic issues means potentially missing critical early warnings about conditions affecting your most vital organs during windows when treatment works best. The Cleveland Clinic confirms that nail abnormalities frequently indicate serious internal conditions, including heart failure, lung disease, thyroid disorders, liver problems, and various forms of anemia. Yellowing nails can signal fungal infection, but also lymphatic problems or lung disease. Clubbing, where fingertips enlarge and nails curve around them, often indicates heart or lung conditions affecting oxygen levels. Spoon-shaped nails that curve inward suggest iron deficiency anemia. Horizontal ridges called Bowes lines appear after serious illness or nutritional deficiency, marking the period when nail growth was disrupted. Dermatologists at Johns Hopkins specifically trained to recognize these patterns, but you can learn to notice changes too. Each nail serves as a tiny recording device, documenting your body's internal condition over the past several months of growth. The danger of ignoring nail changes lies in missing opportunities for early intervention. Conditions that cause nail abnormalities typically progress over time, becoming increasingly difficult to treat as they advance. Catching thyroid imbalance early means simple treatment. Catching it late means managing complications throughout multiple body systems. Identifying circulation problems when nails first show changes allows intervention before heart damage occurs. Recognizing lung disease at the first sign of clubbing provides treatment options that may not exist once the condition advances. Marcus, a 71-year-old retired accountant, casually mentioned his increasingly curved fingernails during a routine physical examination. His observant physician ordered chest imaging that detected an early-stage lung condition requiring prompt treatment that might have been unavailable had he waited longer. Begin examining your nails weekly under bright, natural lighting if possible. Remove any nail polish so you can observe true nail color. Look at each nail individually, checking for yellowing, white spots, dark streaks, or unusual coloration. Notice whether nails appear thicker than usual or seem to be separating from the nail bed. Observe the shape of your nail beds and fingertips, watching for any enlargement or unusual curvature. Compare your current nails to how they looked 6 months or 1 year ago, noting any changes you can identify. Report any new abnormalities to your doctor at your next appointment or sooner if changes seem significant. Your nails have been sending you messages about your internal health for your entire life. So this week, finally commit to listening carefully to what they are trying to tell you. Habit 5. Skipping regular hair and scalp care. Your hair and scalp reveal far more about your internal health than most people ever realize, and experienced physicians notice these signs immediately during examinations. Hair serves as a historical record of your nutritional status, hormonal balance, and circulatory health over recent months. Because hair grows slowly, changes in thickness, texture, and distribution reflect underlying problems that developed weeks or months before becoming visible. Your scalp similarly provides important diagnostic information through changes in oil production, flaking, coloration, and sensitivity. Neglecting regular hair and scalp observation means missing early warnings about treatable conditions during periods when intervention works most effectively. Research published through the American Academy of Dermatology demonstrates that sudden hair thinning, excessive shedding, or scalp changes can indicate thyroid dysfunction, nutritional deficiencies, autoimmune conditions, and circulatory problems in older adults. Harvard Medical School researchers note that these external changes often appear months before blood tests show measurable abnormalities, making visual observation an important early screening tool. Thyroid disorders commonly cause hair to become thin, dry, and brittle, sometimes with noticeable loss at the outer edges of eyebrows. Iron deficiency creates diffuse thinning across the entire scalp rather than pattern baldness. Autoimmune conditions may cause patchy loss or scalp inflammation that precedes other symptoms. Even stress and nutritional inadequacy write their signatures across your hair and scalp in ways that attentive observation can detect. Ignoring changes in your hair and scalp means allowing underlying conditions to progress unchecked during the exact period when treatment offers the greatest benefit. Thyroid imbalances caught early often require only minor intervention. The same imbalances caught late may have already affected your heart, metabolism, and cognitive function. Nutritional deficiencies addressed promptly resolve completely, while long-standing deficiencies may cause lasting damage to multiple organ systems. Carolyn, a 68-year-old retired librarian, assumed her gradually thinning hair was simply an inevitable part of aging that required acceptance rather than investigation. When her physician ordered a comprehensive thyroid panel based on other subtle symptoms, results revealed an imbalance that had been developing for months. Once treated, her hair loss stopped completely and began slowly reversing. Develop the habit of examining your scalp weekly while washing or styling your hair. Gently part your hair in multiple locations, looking for unusual dryness, excessive flaking, redness, sores, or color changes on the scalp itself. Notice how much hair remains in your brush or collects in your shower drain, watching for significant increases in shedding over time. Pay attention to changes in hair texture, whether it seems coarser, finer, more brittle, or different than you remember. Track these observations over weeks and months, looking for patterns rather than single occurrences. Report significant changes to your physician, who can order appropriate testing to identify or rule out underlying causes. What happens on your head directly reflects what happens inside your body, so stop ignoring those signals starting today. These 5 habits require nothing more than a few minutes of daily awareness and cost absolutely nothing to implement. Your body communicates constantly through these visible signs, telling you about your heart health through your gums, your circulation through your feet, your emotional and cognitive well-being through your bathing routines, your organ function through your nails, and your metabolic balance through your hair and scalp. When you begin paying attention and responding to these signals, you give yourself extraordinary power to catch developing problems early, when solutions remain simple and outcomes stay favorable. Small daily actions, consistently performed, create the foundation for years of continued health, independence, and vitality that every person deserves to enjoy. If any of these habits made you realize something important about your own health, take a moment right now to share this video with a friend or family member who needs this information today. Leave a comment telling us which habit surprised you most or which one you plan to address first. Hit the subscribe button so you never miss valuable information designed specifically to help you protect your health and maintain your independence for years to come. Your next step toward better well-being begins with the simple choice to pay attention to what your body has been trying to tell you all along.